Happy Friday, everybody. Welcome to the greatest show about plastic surgery, health, and beauty. This is Nip Talk. We got a great show for you today. First off, the healing power of copper, ? Then, how to fix a giant chest wound. And then finally, fake plastic surgeon is arrested. You're not going to believe this story. It's crazy. We're going to talk about all of it right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I am your host, plastic surgeon Dr. Bruce Hermann, and with me, as always, is the wonderful, the amazing Sarah.
Hi.
That's a good introduction, isn't it?
Yeah, it's fitting.
In the box, we got Travis. What's up, man? How you been?
Hey, I've been good. How about y'all?
Been good. So I guess even though we had episodes the last couple weeks running, we haven't seen each other in a few weeks.
Yeah.
Because we double stacked episodes because Sarah and I were both out of town each weekend. So it's like I haven't seen you guys in forever. I missed coming up here, honestly.
Yeah, where did you go?
So I went on a motorcycle trip.
Yeah.
My daughter and I actually took a motorcycle to Hot Springs, Arkansas, and went to the Ozarks. And it was amazing. The weather was perfect. Just perfect weather, great riding. Good bonding time. Daddy
I've been
daughter
to the
stuff.
Ozarks. That's pretty.
It's beautiful. Honestly, I wouldn't mind having some land out in Arkansas. It's just really pretty out there.
Whenever I would go there, it was like church group, like youth group things, and it was like we'd stay in these like mansion style cabins.
Cabins, yeah.
Is it the Ozark, like the TV show Ozark?
Yeah, so the Ozarks like come down from Missouri.
Those are mountains.
Yeah, into like the very northern part of Arkansas. And it's not like super mountainous, but it's way more hilly than it is here. And it's like forest. I mean, it's just beautiful, and rivers and the whole thing, man. It's really cool.
Really cool. Yeah, it sounds like it.
Arkansas is really pretty. So
It really is.
And you went camping too, right?
I did.
Was it good?
I went to the Hill Country.
Oh, Hill
in
Country is also
Texas.
amazing. Yeah.
So it was near.
Fredericksburg.
It's not Bernie. It's near Fredericksburg, but it was another town. I can't remember.
We go down
but
there a
it's
lot
somewhere around there.
on motorcycle trips also, because Hill Country is just amazing.
Yeah,
it's
it
so
was really
beautiful.
fun. It was like a women's retreat. It was like a yoga women's retreat.
Oh, nice.
So we did like sound baths and
That's
this,
cool.
like meditation
Right on.
and all this mindfulness.
Did you get all
stuff.
like rested and?
Yeah, I didn't use I think I maybe used my phone like once because I went into the woods like by myself, like on a trail, because I wanted to like put my hammock up and just kind of like chill. And so I was like, I better bring my phone like just in case.
Just in case, right?
Yeah, but that's the only time I had it. And then at night,
Awesome.
I guess, but.
Oh, guys, I have to tell you, you guys have fans. So we had our Halloween party, I guess last weekend, which I have a picture. So obviously my hair is not normally this color. I actually colored my hair for Halloween because I went as Ken. So throw up that picture of, there we are. That's me.
Your makeshift abs.
Yeah, my abs are kind of coming back with all the running, but I helped him along with a little concealer there.
Contour.
But we were Ken and Barbie, and then there's my daughter. I can't remember what character.
She's a little anime character.
Yeah, she's an anime character. I can't remember which one. But so anyway, we had this Halloween party, and like a lot of people asked where you guys were. They were like, I had a lot of people say, hey, we really enjoy watching the show. Like, is Sarah and Travis coming? I'm like, oh, I don't know if they're gonna. I knew you were gone, and Travis probably has got better things to do on a Saturday night than trek out to the boonies. But seriously, people were asking about you two guys. Like, they were like, is Sarah and
I would
Travis
have definitely gone if I wasn't camping.
That's dope. I think I had to work on Saturday.
No, but they were both, honestly, like people were saying like they really kind of liked the chemistry of the three of us, and they were really, I wasn't like expecting that,
My mom surprisingly watches this.
Does she?
So I'm like, hi, Mom.
Hi, Sarah's mom. But anyway, I just want to let you
watches
guys know that. I thought that was really cool. Like I was like, yeah, people actually really enjoy it, and they enjoy you guys. And so next year you guys will have to come because The people demand
We're
it.
kind of a big deal.
We are kind of a big deal. That's right. All right, so let's move on into some segments. In this first segment, actually, my friend Mike, who actually I went to college with, actually gave me the idea for this segment talking about the health benefits of copper. And
Oh yeah.
yeah, it's one of those things where you see people wearing copper bracelets, copper rings, and you'll kind of hear this about different ways copper is used for your health. And he actually was telling me about his wife has copper-laced pillowcases, and I'd never even heard of that. And I was like, what in the world?
You know what I remember seeing from like being home from school, like during the summer, are those
Copper sleeves.
yeah,
Or
like for
socks.
knees
Copper
and
socks?
like
Okay,
for your
we're-
ankles and
we're
stuff
gonna
like
talk about that, yeah.
I remember seeing those infomercials
Yeah.
for that, like in the middle. I'd be like, gosh, what is this?
What is it? So once again, thanks, Mike, for suggesting this topic. So we're going to talk about a few things here. First, just talk about dietary copper, right? Because copper is a trace element that our body uses for actually quite a few things, even more than I realize. It's used in energy production, formation of connective tissue and bone, the metabolism of iron, brain and central nervous system function. Antioxidants, melanin formation. So copper actually has a lot of use as a trace element. Like it's not like carbon that's making up our DNA or anything, but copper is required for a lot of these metabolic processes that happen in our body.
It sounds like a lot of electrical things.
Right.
That
that would
in your
make
body,
sense, right?
'cause
Like
it's
copper wiring.
Yeah.
Yes, exactly.
Yeah.
So the question is it beneficial to take supplements of copper, right? It does all these things. Do we need to take dietary copper supplements? And kind of cutting to the chase, I mean, the answer is for the most part no. I was going to list out like all of the foods that have copper in them naturally, and it's just enormous. It's like meats, vegetables, fruits. I mean, it's almost like literally grains. I mean, it's almost everything we eat has some little tiny amount of copper in it.
Okay.
And so you don't really have to worry about taking copper unless you have malabsorption issues. So like people that would have like gastrointestinal problems might have copper deficiencies. I think I read that like newborns that have issues with their bowels sometimes will have copper deficiencies. But for the most part, a normal diet gives you plenty of copper. So, for people out there taking copper supplements specifically for this and that, probably not making a big difference. And we've talked about supplements before that, usually, at least in the United States, the diets are so diverse that you don't need to take a lot of extra, and
Right.
copper kind of falls into that. So the next thing that I wanted to touch base on is like wearing copper jewelry. I've seen this before. I mean,
My friend Cassie wears
like copper bracelets,
copper rings. Like she
rings.
has like 3 or 4
Yeah.
on each
Now, does
hand.
she wear them for the look of them, or does she wear them for health?
She probably wears them for both.
For both. Okay.
Yeah, she's very
Right.
spiritual
So the
lady.
thoughts on copper is there was 2 thoughts with the jewelry. One, that the copper like leaches into your system, so you get it like as a trace element, which I didn't see a whole lot of data to support that really is the thing. The other is the anti-inflammatory property of copper, and does it help out with arthritis? And so I tried to find some research that showed that actually is beneficial, and I didn't really find a whole lot. As far as wearing copper jewelry and helping your health,
Yeah.
I'm not sure the data is really there to support that. I mean, obviously, if you like copper jewelry, knock yourself out. I mean, it does look cool, I have
If
to
it
admit.
makes you happy.
Yeah, if it makes you happy, but I'm not sure that wearing it's going to make a big difference. But and I kind of felt like with wearing copper, so I'm going to throw like copper clothing in with like socks, like you were talking about, and then the pillowcases that my buddy was talking about. I honestly, when he told me that, I was like, yeah, that sounds like a lot of nonsense. But I have to say, I was totally wrong. So first off, like copper socks. So what they do is they weave copper oxide into these socks. And I did find a study, I'm going to throw the study up in case anybody wants to look it up. Yeah, copper impregnated socks. So occupational dermatophytosis is just athlete's foot. And so this is a Journal of Armed Forces talking about, do copper woven socks prevent things like athlete's foot in soldiers that are out like in the field, slopping around in the muck. And the research shows that it does. Like if you wear copper impregnated socks, the risk of you getting athlete's foot actually goes down pretty.
What's that other thing that soldiers used to get, like a long...
Trench foot?
Yeah.
Yeah.
Like that. That was like a...
Yeah, I think that's different than athlete's foot. Like that's a
that's
worse
like
thing.
fungus eating.
Yeah, I'm gonna have to look that up. I don't think it's the same as just run-of-the-mill athlete's
No.
foot. I think it's much worse than that.
It's like gangrene, isn't that what it is?
Well, I mean, I think it can become gangrene. Like trench foot, yeah, I don't know. I'll look it up. Maybe
not
we'll
like
do a
the-
segment on it. I don't know if anyone wants to see trench foot, but we may like run our viewers off. Anyway, so there's actually a good study out there that shows that wearing copper socks can prevent things like athlete's foot, which I had no idea. So the copper pillowcases, I had no idea this was a thing. I had to look it up. The idea behind the copper pillowcases is because copper is an antibacterial and antifungal, which is how it works in the socks. The thought is that it can decrease bacteria that would get on your face while you're sleeping, and also
Does it decrease acne breakouts?
Allegedly, that was one of the
think
things
so.
because copper is thought to increase the collagen buildup in your skin. And I was just like, man, I just can't believe that this is real. But there actually is 2 studies out there. Throw up the first study. You can throw them up kind of one after the other, Travis, if you want. Yeah, reduction of facial wrinkles depth by sleeping on copper oxide containing pillowcases. Now, this is a good study, double-blind, placebo-controlled, randomized. This is another one. Both of these are actually good quality studies in the way that they, did them with having a placebo and then it was a blind study. My only gripe is that it didn't have a lot of patients. I think it was like 60 in each one. So overall, it was a fairly small power of study. But both of them showed an improvement in the wrinkles on your face by sleeping on a copper
I
pillowcase.
would buy that pillowcase.
I may actually try it. I mean,
Get it for like a stocking stuffer for your
yeah,
family.
it showed a 9% decrease in wrinkles per month in a 2-month series. It's hard to believe. I mean,
I'd just buy the sheet, like the set.
like, I don't know if the sheets would help. Does that help you, like your whole body just become tighter?
know.
I don't know. I mean, so this copper pillowcase thing, I mean,
I'd
there's
wrap myself up in it.
I'm gonna start wearing copper all over, I think. So there actually is some research out there to back up. Mike, you can tell Kimberly, your wife, that she's right, and I didn't think it was gonna be a real thing, but there's some studies out there showing that copper pillowcases can decrease your wrinkles. I think I'm gonna have to try it. I mean,
It doesn't hurt anything.
no, absolutely not. I mean, you can get copper toxicity, like if you're taking tons of copper supplements, but like sleeping on a copper pillow, wearing copper clothing or jewelry, it's not gonna hurt you.
Yeah.
Yeah, there's no risk in doing it. I mean, it's something you can try. I mean, every little thing helps, right? As we get older, like a little bit of this, a little bit of that to kind of, keep things looking good. Mm-hmm. Yeah, so pretty interesting stuff. So I have to say I was wrong on this one. I really thought I was gonna just find nothing, and then all of a sudden these studies started popping up.
It's a good one. I'm going to have to get a pillowcase.
Yeah, we should all try it and see if we can see any difference. So, all right, well, let me know what you think about copper. Anyone out there have good experience with copper? Let me know, leave me a comment. We'd love to hear what you think. Please hit that like and subscribe button. We do appreciate it. So, moving on. I had actually a really interesting case the other day. And it's a guy I've known for a while, and he's a really, really cool guy, really down-to-earth, great guy. And I asked him if he would let me kind of tell his story and take some pictures and video. And he's like, yeah, absolutely. And he was so nice to do that. So I think you were saying we did a chest wound the other day, and I didn't even kind of think of that when I was coming up with this topic.
Yeah.
So this is a chest wound also, but it's a little bit different type of chest wound. And it's kind of a really interesting story. So I have some like really cool pictures and videos that I want to go. Yeah, so fixing a hole in the chest right there. So
Oh my God.
yeah, this is a big one, man. And the story is just
What part of his chest is that? Like
So it's
by
like-
his collarbone?
yeah, it's underneath the collarbone. Yeah, there'll be a video to show it. So this guy is an older gentleman. He's close to 70 years old, and he had a very interesting kind of congenital anomaly of his chest wall. And because of this congenital anomaly, he actually had a prosthetic placed to kind of even things out when he was like a kid, like 10 years old or a teenager. So this was like 50 or 60 years ago that he had this thing placed. And I actually have a little video of the chest wall, which is just kind of interesting to see. So roll that next video there, Travis, if you would, good sir. Yeah, so this is a CT scan. So this is slices through the chest. The black areas in the middle are the lungs, and this is going from top to bottom. And you can see that the chest, which should be kind of circular or oval, has got this indentation on the right side, the upper right part of your screen, and that's the chest wall deformity that he had. And you can see actually the heart, which should be over to the right, is actually pushed over to the left, which is really, really unusual. You know, the heart's in a completely different spot than it should be. So really kind of interesting, you know, anatomy there. I'd actually got that CT scan before this wound got really big, because what happened was the guy got sent to my wound clinic, and he had this like kind of draining infection from his chest, and he, you know, he knew he had this prosthetic, which is for all intents and purposes was like a breast implant. It wasn't exactly like that, but very similar. And so, you know, when that happens, that you get an infected implant, it has to come out. So he got sent to me, and I initially got a different scan to say, okay, yeah, there's infection around this thing, we got to take it out. And so we took him to surgery, and I pulled that implant out. And the thing is, this thing was really big. And so when I pulled it out, it left this really big hole in this guy's chest. And also they'd placed some mesh there over the chest wall, which I couldn't really figure out why they did that, but I removed all the mesh I could see. And then, you know, we wanted to do something simple. So we started some dressing changes to try and get this thing to heal in. And actually it worked really, really well. And so this guy's wound over the course of a couple months, which I know is a fair amount of time, filled in with tissue. Mm-hmm. And we thought we were kind of done with it, and then the infection came back. And yeah, it was kind of a real bummer, because we gotten it to the very end where he's like, okay, you know, you're pretty much healed. Well, the infection came back, and I ordered another scan, and the scan showed a new area of infection that was kind of away from where we were initially. And so I was like, well, man, we got to take you back to surgery and open this up. And so when I took him back to surgery the second time, what I found is that there was actually more mesh in there than I had initially seen. Like, it was kind of further up, and I really, to this day, not sure exactly what they were doing with all this mesh. But that mesh had gotten infected at some point, and it caused this thing to open back up. So I had to like make a really, really big wound to get all of this mesh out, because that mesh, once it gets infected, it's almost impossible to get the infection out. You have to take it out. Yeah. And so at the end of the day, he was left with a really big wound, which I got a video of the wound after that operation. Travis, roll that. Yeah. So as you can see, this is kind of, you know, right where his nipple would be, and that wound is big. It can be kind of hard to see.
Is he awake?
Yeah, he's awake. Yeah.
What are we looking at? Like, is that like muscle?
So that's his chest wall. So you're basically looking at his rib cage right there.
Oh wow.
And you can even see like on the lateral side out to the right, where there was like this dark area where the chest wall was kind of curving around to the back.
Yeah.
That is just so weird that you can like survive with that.
Yeah, well, I mean, it's all superficial. Like, you know, if you don't want to get through that layer at the bottom, because that's into your lungs, and that's really, really bad.
Yeah.
But thankfully, and that was a concern I had through all of this, is like, is this thing going to try and get into his
organs are going to get infected.
Yeah, right.
Yeah.
Yeah, that was a concern, and that's one of these reasons I kept ordering these scans, to make sure it wasn't getting into his lungs.
It seems like mesh was like this highway for the bacteria to like attach
Totally,
to.
yeah. The mesh really was causing him problems, and so after that last surgery, I'd gotten all the mesh out, and the wound was really clean. And so I talked to him about, okay, instead of trying to get this to heal, let's just do a surgery to fix this. Well, this problem is kind of, you know, a little bit challenging, because the size of that hole was probably about the size of a grapefruit. Mm-hmm. I mean, it's a big, big hole, and the tissues around it are stiff. You can't just pull them together. And so really your options are, you know, you could throw some dressings in there and try to get that to fill in, but it would take an eternity, or you could fill that with muscle. And this kind of goes back to that operation we did, or that we talked about a few episodes ago.
Yeah, the open heart surgery.
Yeah, or the open heart surgery, where we were filling a hole with muscle. Well, the thing is this is a bigger hole. And so you need a really, really big piece of muscle. You also need some skin, because he's got this big skin opening, you know,
it was really
there.
Deep.
Right. And so there is actually a way that you can accomplish all that, and it's by actually using a muscle off your back. So you have a muscle, you know the muscles, latissimus muscle. It's the muscle that helps you do a pull-up, right?
Okay, yeah.
Yeah. Well, that's actually a superfluous.
Lats.
It's a superfluous muscle. I mean, you can totally live your life without a latissimus muscle.
Okay.
So what we do sometimes in plastic surgery for reconstruction is we borrow it, and we take it and we use it to do some purpose. And in this instance, I'm using it to all that muscle to fill in that grapefruit-sized hole.
Okay.
And then using some skin over the top of it to fill the skin hole. So roll that next video, Travis. So this is this gentleman here in the operating room. And so what I got there, that diamond shape is actually where the latissimus muscle is. It starts up there, it goes up towards the spine, across the bottom, and then back up, and that's the muscle. And then that ellipse or kind of oval piece is the skin that I'm gonna take with that, and then I'm gonna actually push it through the armpit area to pull it out through the front to put it in that position. So, so that's him right before we prepped him for surgery. All right, so all right, so this is a little bit of a warning. If you don't like to see blood, I mean, this isn't like.
Ready, Travis? You've already seen it.
I mean,
No, I haven't seen it. I can see the still shot though.
Oh, yeah. So, I mean, it's not like blood flying everywhere, but there's a little bit of blood. So if you're squeamish, just trigger warning, just letting you know. All right, roll film. There we go. Okay, so this, I got the muscle already dissected out. And so I'm holding the muscle in my hands.
Whoa.
And you can see the skin paddles just sitting right on top of it. So what I did is I incised around it, went down to the muscle, then dissected the muscle out on all its edges and off the chest wall. And I got it to where it's just on its blood supply. Now I'm actually passing it through a tunnel towards the front. And then once that's pushed through, then I'm gonna go and I'm gonna close that incision just in a straight line. So then we have to flip him over in surgery, all right? So go ahead and roll the next one, Trellis. So this is actually that hole from the front, and I've pulled that muscle through it. And you can see the muscle, that's all that giant big muscle and the skin paddle on it. So what I'm gonna do is I'm actually gonna stuff that muscle in there, and I actually do suture it. I'm just kind of doing it now just for show, but I'm gonna stuff the muscle in that hole to completely fill it and suture it in place, and then that skin paddle will be right there, and then his problem will be all solved. So I think the next one, Travis, is the final one.
Holy crap, surgeons are crazy wild.
No, the next
Gosh.
one. Or is there, yeah, there we go. All right, so that's after I inset the muscle inside, so I sutured it so it wouldn't try to move.
Okay.
And then I actually sutured the skin to that big hole, and the problem now is completely solved. So, and then I think the last one, Travis, is just, I just wanted to show that back incision. Yeah, so it's kind of not a great picture. I actually took that a few days after a surgery just to show that incision where, that's the back where that kind of big hole was. It just closes up in a straight line. And yeah, the guy's doing great. So far he's doing good, no problems. The flaps looks beautiful. I guess the only risk would be like long-term infection, but so far, knock on wood, he's done awesome. But kind of a cool surgery, right? I mean, you know.
Yeah, absolutely.
I mean, that's how, and that's kind of the fun, one of the fun things about plastic surgery is, you know, you get these problems that really no one knows how to solve. And
But you know how to do it.
Yeah, I mean, it's like, well, yeah, there's a lot of things you can potentially do. I mean, the other way you could have solved that problem is you could have taken one of the rectus muscles, like one of your six-pack muscles. You could take that with a piece of skin and flip that up and use that muscle to fill that hole and also the skin. But the thing is that those surgeries are a lot more morbid. You bounce back really quickly from harvesting the back muscle. If you take one of your ab muscles, like it's a pretty rough recovery, and there's a lot more risks associated with it.
That makes sense because like
Yeah.
mommy makeovers are rough. After
Yeah.
you have a baby, it's
Yeah, sewing up the
rough.
abs, yeah. And this is like even more.
One question I have, like with the skin on his back.
Yeah.
When you took that muscle from out of his back, how do you like cover that whole?
Where you took it from?
Yeah, where you took it from. How do you cover that one up?
So because that skin on the back has got a lot of mobility, you can actually just pull it together. So where that oval was, I kind of ellipsed it into, so it wasn't like perfectly round. It was kind of, we call it an ellipse, so it goes like this.
It's like a little almond shape.
Yeah, almond shape, like a double-sided almond where it's pointy on both ends.
Right.
Yeah, and especially once you take that muscle out, then you got a little bit of laxity of the skin there. And it's not like super sunken in or anything like that. In fact, you can't really tell. But you can pretty easily bring that skin together as long as you don't make the paddle too wide.
So does his muscle like grow back?
No.
No,
No,
he'll just
it's
never have a
permanently gone.
lat muscle.
Yeah, he won't have a
ever
lat
again.
muscle. And you know,
I guess that doesn't matter. He's 70 years old.
yeah. Well, honestly, even for young people, so I've probably done. I used to do a ton of breast reconstruction, and we would sometimes use those to mostly salvage a reconstruction that went bad for whatever reason. So I mean, over the years, for various types of surgeries, I mean, I've done dozens and dozens of those latissimus flaps. And I've only had one person ever tell me that they could tell that their latissimus was missing. And it was a girl who was like really, really kind of active. Like I think she did CrossFit or something. And she's like, yeah, I can.
That's what I would think.
Yeah.
I would be like, I still need to do
the first time you try to go
pull-ups
to
and
do
all
a
this
pull-up without your latissimus muscle, you'll know that it's gone. I mean, but then think of how many people can't do a pull-up anyway, right?
Yeah.
So, your average run-of-the-mill person is not going to realize they're missing it. They still can do this because the shoulder muscles do that as well. The latissimus muscle is just a bigger, broader muscle. So, when you really, really need to pull down on something. But
I think my back muscles are probably some of my biggest muscles that I have.
you have very defined traps.
Yeah, my back is
different.
like 5 times stronger than my abs. So
Yeah.
if I ever
How many pull-ups can you do?
if they're strict, I could probably do like 5, but that's
great,
my
though.
max for me. But guys can do crazy amount because they also have just a lot of back muscle.
Oh yeah, I mean it's a big
Ability.
muscle and it can gain like a lot of size. So I mean when I used to work out, I had decent lats, but nowadays I'm
for kipping pull-ups, like the crazy CrossFit kind,
Yeah.
where you're like moving around. I can do like 10 to 20.
yeah.
But strict, it's a little different.
I always like to do the strict and use that thing where you stand on it and it gives you just a tiniest bit of help.
Sometimes I use the band, like a little stretch band. Yeah.
One of these days I'm gonna get back in the gym. I've been running, but I haven't hit the weights yet. I'm gonna have to because I just need to bulk up, man. I'm too wiry.
That too.
All right, well, I hope you guys like that. If you guys have any questions about that surgery, drop a comment in there and let me know. And once again, thanks to the gentleman who let me use his story. I think we got his problem solved. He's a great guy. I'm really happy that he was nice enough to do that. So thanks so much. Yeah. All right, moving on to a pretty crazy segment.
Yeah, let's figure out where the surgeon's from.
Where do you think he's from?
Florida.
Oh man, you are not right this time. Oh. I mean, that's a great guess. He's actually from Texas, yeah. So I saw this news article pop up about this guy who was arrested for practicing medicine without a license, which basically means it's a non-doctor posing as a doctor. And I was like, oh, this is interesting. Well, he was posing as a plastic surgeon, allegedly. This is all allegedly. Yeah, so I called him the plastic surgeon impersonator because he was impersonating a plastic surgeon. So this guy is from Houston, and he was working at one of these, my favorite places, the plastic surgery mills.
Okay.
This one was the Houston Aesthetic Center, which I think is still open. And so what happened was this facility, and specifically this, what they call him doctor, got a lot of complaints to the Texas Medical Board about botched operations. And so the Texas Medical Board figured out that this guy, his name's Alexander Padilla, doesn't have a license, medical license. And so if he doesn't have a medical license, it means one of two things. He either came from another state as a doctor and didn't get a medical license, or he's just not a doctor at all and he's impersonating a doctor.
Oh, so could it be possible that he went to school?
I mean, it could be possible.
But he just didn't pass.
But it wasn't that. No.
He didn't even.
Yeah. So this is a pretty crazy story. So, so the Texas Medical Board then contacted the police and they set up a sting operation and they had an undercover agent go there and posing as somebody who wanted plastic surgery and wanting a breast augmentation. And saw this guy, Alexander Padilla, who said, yeah, I've done tons of breast augmentation surgeries. I'm happy, we'll do your surgery. It'll be $7,500, which is kind of crazy because, you figure if this place is really shady that the prices would be really cheap, because who would pay top dollar for crazy, plastic surgery by a non-doctor? Mm-hmm. That's pretty expensive, $7,500. I mean, that's pretty, I think ours are a tiny bit more, but it's the ballpark of what we charge as somebody who's a true expert in this. Anyway, I thought that was crazy. So yeah, so they arrested the guy, for practicing.
I wonder how they did it. I'm just.
It's a sting,
head,
man. It's like a sting
operation. In my
operation.
head, I'm thinking of this lady police officer with her chest out, and then he's okay.
Totally. That's how it went down. Yes.
And then he's like, okay, it's gonna be $75, and she's like, you're under arrest, with
yeah, $7,500.
Topless.
Where'd she keep her handcuffs, right?
That's so extra. That's so dramatic.
Sarah always brings up the things I didn't think about that, but right, it's where did the girl keep her handcuffs?
She's
right?
just pulls out her freaking cop thing, her detective badge.
Meanwhile, the true story is she was in for a consultation. She fully clothed, and she was like, okay, now you're going to jail.
But no, I think I did say that the guy did a breast exam on her. So it was it's like those things where you go full on, like you're going diving deep.
Because they had to prove that
Yeah, they
he
had to
was,
prove
like,
that it was
you know,
like happening, right? All right, so they arrest this guy.
What a creep.
And so come to find out, this guy's real kind of background is he's a CST, which is a certified scrub tech. So he's a scrub tech. So in the surgery, so for those who don't know, when I do surgery, there's me, the surgeon, there's the anesthesiologist, which puts the patient to sleep. There's the circulating nurse, who their job is to help get the patient ready for surgery and go and get suture or instruments or whatever we need. And then there's a scrub tech, which the scrub tech basically hands me the instruments, all right? So this guy's a scrub tech, but he was posing as a surgeon at this facility, which is just mind-blowing, because that's a felony. I mean, this is a felony especially if you cause harm to someone impersonating a doctor or a surgeon. Like, we're talking like felony charges here. Like, it's wild. And so I had to look up this facility, because I was like, what?
Yeah, because I'm like,
what kind of
did they
place?
not do like a background check on this dude?
Well, they had to know. I mean, the guy's on the webpage. So throw up that next picture there, Travis. So this is from their webpage, which is still up, and that's the guy that got arrested on the right, and it's in Spanish. And so I translated that. One, I speak Spanish, but two, it's easy to hit Google Translate. And it talks about him being a scrub tech. It doesn't say that he's a surgeon, but apparently he was doing surgery there.
Well, they don't even usually websites, when they talk about doctors, they put their like how you say it says MD after your name. Like, usually that's how doctors' names are written out, with their I forget what
with
they're
all their
called.
credentials on it.
Yeah.
So I looked at these other guys. So one guy, Dr. Giraldi, get a load of this. He's an internal medicine doctor.
And he is a plastic surgeon.
No, he's not a plastic surgeon.
I know, but he's a plastic surgeon.
He's doing cosmetic surgery as an internal medicine doctor at this facility. And then the other guy, Dr. Rivas, he's a general surgeon. I mean, at least he's a surgeon, but did not train in plastic surgery. I mean, I don't know. I mean, there are problems with the laws in a lot of states, and Texas included, that.
And then I guess they're probably a facility that does
Right.
in-house.
Exactly.
Surgery.
Right. Sarah, you're so smart. Yes. These people can get privileges at a hospital or an accredited surgery center to do these procedures, because they're not. In order to get privileges at an accredited hospital or accredited surgery center, you have to train at a program that's ACGME, which basically is the governing board for what programs are legit. Mm-hmm. And you have to have a board certification in plastic surgery, which to get that, you have to train at an ACGME program. So none of those guys, even the...
Well, it sounds like they cater to a certain demographic.
Yeah, I don't know.
So
I mean...
that's really... It's almost like they're preying on people's ignorance.
Like, they're preying on people that are vulnerable. Yeah.
Yeah.
They are.
There's like a verbal barrier.
Right.
So it's like they want to go to these doctors because they speak Spanish and all of that. So it's easier to communicate. Yeah. But it's like it's easier to communicate with what you want, et cetera, and they feel more comfortable. But at the same time, it's like they're just preying on this demographic. It's gross.
I mean, I assume that this place will have to be shut down because
it should.
They were letting a non-surgeon do surgery. Like, that's, I have to assume that something else is going to happen outside of just this one guy gets arrested. I mean, I don't know how they would allow this facility to keep running when they do something like that. But the problem is like there's just, it's difficult, right? Because they don't, it's not like a hospital that the government can come shut down. Like, I don't know how. That's why I say that there's not a lot of protection against places like this. We've talked about this.
That is so weird.
We've talked about this a million times, that what an office does to someone who gives consent for, it's very broad. Mm-hmm. I mean, you got an internal medicine doctor doing surgery. I mean, that's insane.
It almost kind of reminds me of like back in the Old West, like dentist doing surgery. Oh, you got a bullet wound and I need to pull a tooth out?
Yeah.
All right.
All right. Pull your horse up.
Yeah.
So yeah, it'll be interesting to see. I'm going to kind of follow that story and see if anything else shakes out of that. It's kind of wild, and it's kind of scary that it's happening in our backyard. You know, you said Florida, and we've seen, you know, stories like, I don't know if we've seen a story this bad where like a non-doctor was doing surgery at like a facility.
I want to find out about that doctor that murdered somebody in the bathroom at a.
How did we find out about that?
You.
No, I know. What were you asking? Whatever happened?
I want to know what happened to him.
She's in jail for murder. I mean, I'll look it up. I forgot about that. Yeah, I mean that guy. I mean, I shouldn't say. Yeah, because I don't know.
They said that it wasn't like for sure or something. Like they could.
I mean, they have video of him entering the building when the guy died, and him exiting with a big tarp with something wrapped, like the tarp wrapped around something, which you assume is a body. And they found the guy's blood in his car. I mean, I'm not like a lawyer, but it sounds like a pretty open and shut case. I'll look that up. Yeah.
Real quick too. Cindy Hermann, she said she's 100% out on the trench foot segment. She said, just saying.
My wife hates feet, so.
Oh, really?
Oh, yeah. She's got a phobia. I can make her cry by putting my feet on her.
Oh, no.
Yeah, it's terrible. Yeah.
That's interesting.
You have to sleep with socks?
No, but I'll put my feet on her, like she'll start kicking me. Yeah, it gets violent. Yeah.
It gets violent.
Yeah, if I like hold her down, put my feet on her, she'll cry like tears, like the whole thing. I mean, I wouldn't do that, but I mean, I have like maybe once or twice, like big tears.
Halloween would be the perfect time to play like a foot prank on her.
A foot prank.
Like a cut off foot and like put it in a punch bowl and she like got.
No, what if you went for Halloween next year? It's just a big foot.
A big foot. I don't know. I don't think she would like that. My wife, she's kind of got a weak stomach too. Like. One time it was so fun.
And she's in the medical field too.
Well, it's weird. Like she can do like surgery. Well, she doesn't do surgery anymore. But when she was an OBGYN, she was doing surgery. It's fine. But then one day we had a turtle in our yard, and like the sight of the turtle was making her vomit. It was so funny. Like, I mean, granted, it was a scary turtle. Like it was a snapping turtle, right? So they're like prehistoric looking. And my wife's like, like toads. Like she will.
Like stuff that it's just like
so
creepy.
Funny.
I guess
she thinks feet are creepy.
The turtle was just disgusting.
Dude, it was so
I've never heard of that reaction to a turtle.
Oh my god, it's so funny. I think I have a video somewhere of her like
all
getting.
I can think about are those cat videos. Whenever you like give you show like a cat like something you're eating, and like the cat goes like that, and it like makes the noise. Yeah.
Oh my god.
The cat will just like lightly smell the food.
Yeah, I mean,
just,
I love my wife to death, but certain animals, man, like just set her off. One time I was walking.
I'm guessing snakes too.
Not as bad, but like we get those little newts, I guess, or
little lizards.
They're not lizards. They're newts or geckos. They're geckos.
Oh, okay, yeah.
And
they're kind of like white sometimes.
Yeah, they're white or peach color. So we get them all over our house. And one time I was walking through the door and one fell and it landed on my neck and it started like running around my neck. And she freaked out. Like, I thought she was gonna like have a heart attack.
She's like, burn it, burn you too.
She's like, I'm gonna have to divorce you now. You got a gecko on you.
Oh god.
Anyway, yeah, the turtle incident was. That's probably my favorite.
That's funny.
Even like if I talk about the turtle, she's probably at home gagging right now.
She's already turned it off.
Yeah, she's like, I'm not hearing about that turtle.
She's like, unsubscribe.
Next week I'm gonna bring a picture. I took a picture of the turtle. It was a very scary turtle, but I don't know.
I can see that, like just creepy stuff makes her gag.
Yeah,
that's hilarious.
So funny. Creepy things.
Interesting. We got off on a tangent there, but yeah, the feet. Yeah. Anyway, pretty crazy case. I'm going to follow up on that because it'll be interesting to see what happens. I mean, just getting these news reports from these various outlets are talking about, it's still kind of early, so there might be some more stuff shake out from that. But yeah, you got to be careful. Like, so what's to learn from this? You got to do your research. Like, if you're going to have surgery, you have to make sure that your surgeon is actually a doctor. Number one, that's important. But also very important is make sure they're board certified. And board certified in the specialty for which you're having done.
Is there like a website you can go to?
Yes, there absolutely is. The American Board of Plastic Surgery. You can look it up. So if you go like put my name in there, it says, yes, Dr. Hermann's actually a board certified plastic surgeon. He's legit. So that's a great resource and a very good point. Sarah, thank you. That's why we have you here, among many other reasons. So. All right, guys. Thank you guys so much for tuning in. We really, really do appreciate it. Please hit that like and subscribe button. Leave us a comment. We want to hear from you. We'll see you next week on Nip Talk. Bye-bye.
Bye.